Welcome to another edition of the Rome News-Tribune Studio Central Face-to-Face. I'm Associate Editor Doug Walker. Our very special guest today is the Commissioner of the Georgia Department of Early Care and Learning, DECAL, I believe, Bobby Cagle. Commissioner Cagle was up in Rome recently speaking with the Health Department Board here and took some time out of a very busy schedule to come by and visit with us. So, Commissioner, I guess let's just start by telling everybody, I'm sure that everybody knows who DFACS is and this and that and the other, but I'm not sure that everybody in our audience understands what DECAL is.
DECAL, the Department of Early Care and Learning, is the state agency that is charged with the early education of children in Georgia, in particular children who are age birth to 5. We operate the state's pre-K program. We also license and monitor about 6,000 facilities around the state that serve about 375,000 children on a given day. We also operate kind of a unique program, which is a analog to the school lunch program, but it serves meals in child care facilities around the state for children in need. And so we serve about 88 million meals through that, through contracts around the state annually. So we are tasked specifically with early education work and are one of 3 in the nation that have standalone state departments. So the leaders of the state under Governor Perdue decided that it was important enough to have a dedicated state department.
Well, I understand that, I guess when we talk about early learning here in Georgia, I suppose a lot of people think about the pre-K program and they think about child care. Tell us how we determine, because the pre-K, of course, funded largely by the lottery, how do we determine the number of slots and where they go? We know many of the public schools, if not most of the elementary schools in the state, have pre-K classes. We also know that a lot of child care facilities have pre-K classes, but not all of them.
Correct. So the slots are actually determined in the state's budget process and primarily is determined by the amount of revenue brought in by the lottery. This is a 21-year-old program that is one of 2 programs funded by the lottery proceeds along with the Student Finance Commission and scholarships for college students. We are able to provide pre-K to 84,000 students around the state at this time and are anticipating keeping that same number for the upcoming year. That's about 60% of the 4-year-olds in the state of Georgia.
What happens to that other 40%?
You know, that is a variety of answers, to be honest with you. You have some children, about 7% of all 4-year-olds, who are served by Head Start. We also have a number of children who are served in private settings. You have parents who decide not to send their child outside the home or to stay with relatives and family members. So there are a variety of choices, and it's all driven by the parent as to where they are. There is a waiting list with our pre-K programs, very popular and very much deservedly so. It is one of the top programs in the nation, one of the oldest in the nation.
The Bright from the Start program, which I guess is almost another name for the department itself.
That is correct.
Early learning, we've determined, is pretty critical to a child's success. So how do we deal with those children who are not able to get into one of those pre-K slots?
Well, what we try to do is to assure that they have quality child care elsewhere. So another of our responsibilities as a state department is to assure that we are continuously improving the quality of early childhood education. We do know that children who get good, high quality early childhood education definitely benefit. They're more likely to go on to graduate high school, graduate college, get good jobs, and interestingly are more likely to have good health outcomes, as studies have shown.
How closely does your department actually monitor the education in the private setting?
We monitor it very closely, primarily around health and safety. So we see health and safety of children in facilities as our primary responsibility, with a close second being the quality of the education delivered there. We monitor each facility a minimum of twice per year and then follow up on other concerns as they come along. We also have initiated a program called Quality Rated, which is specifically dedicated to providing resources, education, training, and supplies for facilities to raise quality around the state.
Now, you also mentioned that the department deals with the nutrition program. I know here in Floyd County there are a lot of different education agencies, the public schools, a lot of churches are involved in the nutrition program, particularly during the summer.
Yes.
How do you monitor and oversee that?
We have consultants who are charged with carrying a caseload, basically, of facilities that are part of the program. We have thousands of those around the state. They do serve meals both during the school year to children at breakfast, lunch, and snack in the afternoon. We also have a new program that serves extended day for children who may not get meals at home. And then in the summertime, we have the Summer Food Services Program, which is operated again through community organizations all around the state, including private nonprofits, the faith-based community, just to name a couple.
Now, this is a relatively new agency within state government, or at least separated out on its own. How difficult has your job been these last couple of years? I think you were appointed in January of 2011.
That's correct.
These last couple of years, how challenging has it been with the state budget as tight as it's been?
You know, I think this agency has probably fared better than most because the lottery revenues fund a good portion of what we do. The lottery revenues have been fairly stable and actually increased even during the economic downturn. We did, however, have to do some tightening of the belt, like most state agencies. The governor, in looking at our pre-K program, determined that we were spending at a rate that would outstrip the revenues at some point. So we had to cut back a bit in 2011. We did that by cutting the number of days that teachers worked and children attended school. We also did that by raising class size by a couple. During the interim period, we've been able to add back all days, so we're back at a 180-day school year for all children in the pre-K program, and are working toward lowering class sizes from 22 to 20 because we know that that is very closely associated with the kind of experience a child has and the benefits that they derive from participation.
Now, the agency also regulates child care facilities.
We do.
In the state of Georgia. How big of a challenge has that been? Because obviously with some cuts, numbers have gone down, and there must, who knows how many. I guess you maybe know how many child care agencies there are.
As of yesterday, we had 5,987, so near 6,000 facilities around the state. We are charged with the responsibility of monitoring health and safety in those facilities, as well as things that affect quality, such as teacher qualifications. So we are engaged in that on a daily basis. Actually, the number of facilities has dropped during the recent economic downturn, in large measure because the demand dropped, because people were not working. So we are seeing a rebound in that. I see a stabilization of the number of facilities that we have, and we have been able to cover those well. And I think with the smaller number of programs that we're monitoring now, we're able to do a more thorough job, and I think will lead to long-term quality.
Now, doesn't the state also provide a good deal of subsidized revenue to a lot of the child care for low-income families as well?
We do. In Georgia, we call it the CAPS program. It is Child Care and Parent Services. This is a federal-state partnership through the Child Care Development Grant. In this state, it runs about $121 million annually, and this is devoted primarily to those who are what we would call the working poor. Those people who are doing their very best to make a way for their family are working on a daily basis and otherwise could not afford child care and early education. So this is a program that supports work, supports self-sufficiency for families, and provides a good quality education for the children in the state. That program was moved to us in 2012 by Governor Deal with the express purpose that we would focus it on educating children as opposed to providing just child care.
One of the questions that I have heard from some of the child care folks involves a lot of the public schools now providing after-school
Yes.
programs for kids. And some feel that that's cutting into, the public sector is cutting into their private care of kids and is taking revenue away from them, and that's potentially a reason that some of these centers have gone under during this recession. Is that an issue that you've heard at the office in Atlanta?
You know, we have heard that. I think what we're seeing and hearing in regard to that is symptomatic of an economy that has been on a severe downturn. Schools have begun to provide a lot of that care, and that is in part an impact on providers that have previously provided that. However, I think schools, in looking at it from their perspective, have merely been reacting to a constricting market for childcare. So those after-school programs were not there, or either were not there in the areas that they were needed. So schools have seen a need and stepped forward to provide that. What we try to do as an agency is to provide technical assistance on providing quality after-school services, regardless of whether it's in a public or private setting.
What have you seen in terms of demographics in the state of Georgia? Are the number of 0 to 5 children, is that number growing, shrinking, or is it maintaining fairly stable?
The birth rates have, from the last census, shown a slight decrease in the number of children that are being born, and so that results, of course, in a cohort of children that is a smaller number than what we've had in the past. Not significantly smaller, so we still are in need of all the services and all the facilities that we have, but it does cause us to very carefully tailor services we do provide to the particular area that the child lives in. So we need to, as an agency, be much more aware of shifting population. We have begun to do population estimates that are well in advance and plan based upon that. What we're seeing very interestingly in terms of shifts of population is a shift from urban to rural. So we've done a lot of shifting of classes in our pre-K program in particular based upon those demographic shifts.
All right. Commissioner Bobby Cagle with the Georgia Department of Early Care and Learning, we thank you for taking time out of a very, very busy schedule to be with us, and we thank you for being with us on another edition of Face to Face.